Hello, and welcome to CareSmartz360 On Air. I'm Dennis Gale, Senior Sales Consultant at CareSmartz360. Today, we are honored to host Laurel Gillespie, former CEO of the Canadian Hospice Palliative Care Association, the national voice for hospice palliative care in Canada. With over 20 years of nonprofit leadership and a sharp strategic lens, Laurel is shaping how Canada prepares for aging, access, and advanced care planning. So, in this episode, she joins us to explore the future of hospice and home care in Canada and what leaders must do now to ensure compassionate, sustainable care for every community. So, welcome to the podcast, Laurel.
Thank you so much, Dennis, and CareSmart360 for hosting me today. And I'd like to begin by acknowledging my gratitude to our Indigenous people in Canada and how proud I am to live in a beautiful city modernly known as Ottawa, the capital of Canada. Ottawa was built on unceded Anishinaabe Algonquin territory and honors the peoples of the land of the Anishinaabe Algonquin Nation, as well as all First Nations, Inuit, and Métis peoples. So thank you.
Correct. Thank you. Thank you. We're really glad you're able to take out the time today for our listeners. And without wasting any time, I'll straight away jump in with my first question for you. All right. So, Laurel, from your perspective, what are the biggest structural gaps in hospice and home care across Canada today?
Yeah, I think it's really important just to provide a bit of context with how our system works here in Canada. So we
Hmm.
have the Canada Health Act, and it covers a range of health services, including medically necessary hospital services that are deemed medically necessary by a healthcare professional. So physician services, surgical dental services, extended healthcare services. And the Canada Health Act ensures that these services are provided to insured persons without financial burdens or barriers, otherwise promoting access to quality healthcare for all Canadians. So there's 13 different systems with our 10 provinces and our 3 territories that we're dealing with.
Hmm.
So therefore, we have 13 different jurisdictions that are governed by the Canada Health Act.
Okay.
Palliative care, though, is an approach to care, ensuring from the onset of a new diagnosis that you have access to those supports and programs that may benefit
Okay.
an individual and can last several years. So the recommended number of hospice beds per 100,000 is 7. And as of May 22, we fell
Hmm.
short at the average about 3.97. So that's not meeting the
Oh.
targets that are set forth by WHO. So I think access to care
Hmm.
and increasing the number of beds that are available either in the community, at home, through long-term care or hospitals or individual hospices is where the gap is needed, as well as the appropriate funding from federal government to those provinces in order to deliver the service.
Oh, okay. And how can home care agencies better align with the national hospice and palliative care priorities while managing operational realities too?
Well, I think one has to look at the socio-demographics of our aging population and how can we best prepare for that in the future. You
Hmm.
know, fortunately, the silver lining of COVID was that it really removed the layer or took the cloak off of what the reality is in dealing with, fragility and aging, and how can we best support and care people while preserving their dignity. So where I see an opportunity is embedding a palliative approach and keeping people out of those most expensive beds, which are acute care beds in hospitals. We don't
Hmm.
go to the hospital to die, we go to the hospital to get fixed or get
Yeah.
better. So I
Yeah.
think we really have to shift that whole mindset around how we deliver service and keeping people unnecessarily out of those acute care beds
Hmm.
when a palliative approach to care might be better serviced or served to them.
Okay. And what policy shifts should agencies be preparing for to ensure sustainable funding and access to end-of-life care?
I think one of the biggest shifts, and from people that I've talked to from a personal perspective, not so
Okay.
much the policy, and
Uh-huh.
is that people want to be at home.
Yeah.
That's where their comfort space is. Be surrounded by their own familiar belongings, their pets, their family, their loved ones, neighbors coming in to visit. So I think we really, in order to meet the needs of an aging population, a shifting demographic, the burden that unnecessarily sometimes is placed on transferring people from like long-term care with the fall in the middle of the night to
Mm-hmm.
the emergency room. Well, if we talk about what that person's wishes are, if they're 89 or 95, and they have significant other co-occurring issues, do
Mm-hmm.
they want to be put under for a hip replacement at 95? These are discussions that can happen to keep people out of. And so I'm trying to introduce a little bit in there the philosophy behind advanced care planning,
Okay.
and having these difficult conversations with family well ahead of time when they're needed. So I think keeping people at home where they want to be
Yeah.
is a really huge opportunity to fill those gaps.
Yeah. The comfort place. Okay. And how can agencies integrate advanced care planning into everyday workflows without overwhelming care teams?
Well, I think it's a win-win-win, right? I've been a caregiver a few times over now and had the personal experience of having a loved one die,
Mm-hmm.
that's had an advanced care plan, and then another that didn't. The
Okay.
one that didn't, like, you're left in the end with, did I do this right? Did I honor them? Was that what they wanted? Whereas when you have these, albeit they can be difficult to start,
Yeah.
but these conversations are essential, and I believe that now is a time that's more important than ever historically because of the demographics and the competing priorities for tax dollars to be spent on healthcare. How can we do it smartly? Or more smartly and more effectively and efficiently.
Yeah.
So advanced care planning, I've had this dream of embedding a QR code on our universally funded universally funded public healthcare system in Canada, where we each in each province have our health card. And on the
Oh,
back of that, you have a QR code that, boom, takes you to everything from blood type, medications, who your specialists are, and oh my goodness, your advanced care plan.
yeah.
And it
That's
doesn't
great.
have to be it doesn't have to be all dry and morbid. Like my youngest is 25 and I am
Uh-huh.
of that age and I don't mind using my sense of humor. Is
Yeah.
I said, if I'm not able to convey my or communicate or convey my wishes, if I'm in
Mm-hmm.
that situation, please make sure you bring a pair of tweezers in your handbag. And if you see a little gray hair, please get them out. Allow
Got
me to
that.
have some dignity. That's important to me. It might not be
Yeah.
important to me 20 years from now, but it is now. So you can have, quite open, candid conversations about a serious topic.
Yeah.
But it should be regular. And also it's about, creating a culture where those conversations are expected,
Mm-hmm.
anniversaries, birthdays, at Christmas. And to me, my personal philosophy is that we have a moral imperative to take care of one another.
Yeah.
But more importantly, I think that having these difficult conversations as a mom and a sister and a partner, that's the greatest gift I can give to another human being, and it doesn't really cost anything. It's just
Definitely.
having the conversation and documenting it. And it
Yeah.
also helps the healthcare professionals because then they too have some guided direction on where you're headed with your care trajectory when things do get really tough.
Definitely. Yeah. It was really nice to hear these things.
Oh,
Uh,
good, good.
yeah,
I'm glad. I'll
definitely.
send you a
Definitely.
copy.
Surely, surely. I would love that. I would love that. And as we look forward toward 2026, already we are in April now. So, what must home care leaders prioritize now to stay ready for Canada's aging population surge?
There's a couple points there. So often when we talk about the age of population, it's something that's coming.
Hmm.
But for many parts of the system, we're already here.
Uh-huh.
It's already happening. It's
Yeah,
just going to amplify and balloon in the next
balloon.
five to
Yeah.
6 years. And we are not equipped or prepared to provide the level of quality care that we're used to.
Hmm.
And we've seen that dangerous slippery slope. So I see it kind of as a trifecta approach to it is healthcare human resources are absolutely a must and a priority in treating and taking care of our healthcare workers with the
Hmm.
dignity and the pay that they deserve, and not being overburdened,
Yeah.
so we can keep them in place. The second is engaging families to become families or chosen family or those in your circle of care, to
Hmm.
be more engaged with your care, but being mindful of the burnout of caregivers at the same time. And the
Yeah.
other one is the openness of government and policymakers to actually
Mhm.
ensure that we are using our tax dollars and our resources in the most efficient and effective way possible. So we need to continue shifting the capacity out of hospitals, as I mentioned before, and into home and community settings in a very deliberate way.
Mhm.
And it's never too early to start that.
Oh, great.
I don't
And
know. In my humble opinion, I guess.
no, no, definitely. The pointers that I'm taking in today, all my listeners would be taking in today, it'll be really helpful for them. It'll be really helpful for them.
Yeah.
And finally, the last thing, the topic everybody is talking about. So, where do you see AI playing a meaningful role in hospice and palliative home care without compromising the human element?
Right. Okay. So patient confidentiality comes first of mind, and we
Yes,
have
of course.
really good policies and laws with our health information protection policies that are in place.
Hmm.
I think, there's the good and bad with everything.
Hmm.
I'm really incredibly excited about the potential for the use of AI in very helpful and healthy ways for both the end user who's using the AI to help the patient, but also protecting the patient and helping them be able to convey their needs. And I think
Okay.
there's really a strong potential in the area of identifying patients earlier who would benefit from a palliative approach to care and
Hmm.
getting that started earlier. Palliative care is not just about the last 3 weeks of life. It's about living your best life at the onset of a newly diagnosed individual. It's about helping them live fully and healthily. So palliative approach to care could be, I'm 19, almost knock on wood. In May, I'll be 19 years out of a terminal diagnosis when I was 38.
Hmm.
And, you know, the use of AI, I've been living a palliative approach to care for that long because, you're chronically terminal. Cancer is not
Yeah.
curable
Yes. Yeah.
yet, hopefully, maybe. And I'm hopefully not oversharing with your audience, but I think it's critical to talk about these things and how, people can be identified earlier and put those social prescribing resources in place at the onset of a diagnosis, not 3 weeks before they die. And that's where there's a huge opportunity for that shift to take place. And also to support families from that caregiver perspective. Caregivers, there's like 1 in 4 of us are currently caregiving, and predominantly it's women that are my age that are also juggling the sandwich generation, right? Like
And the
we're dealing with
generation
aged parents and family
in
members,
between.
as well as raising our own families. So
Yeah.
it could be a great support to me if I knew that AI was there to support me in helping to do my job better and carry my responsibilities and balance them with care approaches to care as a caregiver. So I think there's lots of opportunity, but we have to be mindful and intentful about how we use it in the direction that we take.
Great pointers, great pointers again. One thing I liked a lot that discussing about the things, maybe in the age, whatever age the person is, whatever the position the person is, and discussing it on the occasions, as you said, that was a very good thing. I will definitely make a note of that thing, and for all the listeners too. Okay, okay. So thank you, Laurel. Thank you for your inputs today. It was a great session, a great informative session, and I hope you also had good time sharing your experience with us and all listeners. It would be a great time.
Yeah, and at the end of the day, Dennis, this is really about people. Like you're in an industry where what you're trying to do is help others.
Yeah.
And, how we support them, how we listen, how we honor what matters most to them as individuals. Like if we can build a system that consistently across the country, across your country, then we're not just improving care, we're
Hmm.
transforming it
Yeah.
for generations to come. So hopefully we can find ways to work collaboratively and work together in that pursuit of a moral imperative to take better care of one another. So thank you. I
That's it.
appreciate, I appreciate the time.
No, thank you. Thank you for your time. And thank you to all my listeners today. So I am Dennis Gill signing off today, and I'll be shortly in touch with you again, guys.